Good morning. In this video, we are going to discuss about assist devices in biomedical field. We are having various assist devices in medical electronics field, such as cardiac pacemakers, defibrillators, and dialyzers. In this video, we are going to discuss about pacemakers. In our body, in that sinoatrial node, we will simply call this SCA node. It is responsible for the heartbeat. It will act as a natural pacemaker. It generates impulse. It starts the pulse system. So it generates the impulses naturally, and this will be transmitted to the Purkinje fibers and bundle of HIS to the entire part of the atrium and ventricles. This helps for the contraction and dilation of the heart. Whenever the SCA node is not able to generate the required impulses, then we have to go for the artificial pacing impulses that can be generated by cardiac pacemakers. So, two types of cardiac pacemakers are available: internal pacemakers and external pacemakers. So, the internal pacemakers, it is placed inside the body. It is permanently implanted on the patients, those who are having a SCA nodes failures. So, and also those who are suffered by the permanent heart block. And also with this, here also we are having this internal pacemaker. Pulse generators are available. That will be by doing a surgery, it can be kept inside the body. And also from that, the leads will be connected to the electrodes. The electrodes will be kept inside the surface of the myocardium. So where we are going to place the pulse generator, the exact location is depends upon the following factors. One is types and nature of the electrodes we are using, and nature of the cardiac problems, and mode of operation of the pacemaker system. And also in this here, we can't change the battery often. So there is no external connection for power supply. Entire thing is kept inside. So the pulse generator is completely should have a enough battery, because each and every time we can't do a surgery and we can't recharge the battery. Another one is external pacemakers. That here the pulse generator is kept externally, so that's why it is called as the external pacemakers. From that, the wires will be connected to the electrodes, which will be placed on the myocardium. So those who are having a temporary heart irregularities or disorders, heart arrhythmias, temporary problems, they can go for this external pacemakers. And also during the treatment of the coronary problems or a surgery, during the cardiac surgery, at that time they can go for with this external pacemakers. Here also it consists of the pulse generators. It can be placed in the lower arm of the patients externally. From there, the wires will be given to the inside of the heart. And here the types, we can have a cardiac pacemaker types based on the pacing modes. One is competitive, another one is the non-competitive. The competitive, we are having asynchronous mode or fixed mode. The non-competitive, two things are there: ventricular programmed and atrial programmed. In the ventricular programmed, again we are having two types. Here the R wave is very important for the ventricular programmed. So R wave is, from R wave we can determine the working of the ventricles. Similarly, from the P wave we can determine the working of the atrials. So using this R wave, using the R wave, we can find out the demand mode, that is based on the R wave inhibition or R wave triggering. So we can have two types of pacemakers: demand mode and standby mode. Another one is for atrial. The operation of the atrial can be identified by the P wave. So here in this mode is said to be synchronous mode of the cardiac pacemakers. The first one is, we will see the ventricular asynchronous pacemaker or a fixed rate pacemakers. So it can be implemented in either atrium or ventricles. Those who are having a total AV block, they can go for this method of fixed rate pacemakers. So in this fixed rate pacemakers, we are having two circuits. One is square wave generator and another one is monostable multivibrator. In the square wave generator, it generates the square wave. So the output is given to the square wave is given to the monostable multivibrator, and this monostable multivibrator, it generates the pulses. So here the timing of the square wave is determined by the various factors such as R1, R2, R3 and capacitors. and the output is given to the monostable multivibrator. It generates the pulses. Similarly, the time duration TD of this monostable multivibrator is determined by using these parameters R5, CC, R6 like that. So the output of the square wave is that is astable multivibrator is given to the monostable multivibrator. The monostable multivibrator produces the required impulses. So this is what the working of the fixed rate pacemaker. If you see the disadvantages means here the heartbeat rate is fixed because the pulse rate is fixed, so we can't change the pulse rate. And also if it is suppose the ventricle operates in different rates, then it leads to the severe problem. So ventricular fibrillation is very dangerous. It may lead to the ventricular fibrillation. So to avoid this, we are going for the next method that is said to be standby. The first method is fixed method. There it won't consider any natural activity of the heart. Simply it will work. So those who are having total AV block, they can go for the fixed rate. And this is for standby modus, those who are having temporarily AV block problems. Okay, sometimes it will be working, sometimes it's not working, means they can go for the standby pacemakers. So in this thing, we are going to place the electrodes in the right heart. So they are going to get the R wave information. We are going to amplify it and we are going to filter, and they are going to continuously monitor the R wave. Whenever the R wave is not present, then this refractory period control timing circuit will work, and it may switch on the fixed rate pacemaker, and the impulse will be artificially given to the heart for normal functioning. Whenever the R wave is present, the circuit won't switch on. Okay, this is what the major advantage of the circuit. So here the R wave is present means it won't work. Whenever the R wave is absent or abnormal condition means the circuit will start to work. So because of this, the power consumption is reduced and the ventricular fibrillation is avoided. And disadvantages means it will be very sensitive to electromagnetic interferences, and also here also no synchronization between atrial and ventricular contractions. In this video we have discussed about the two methods of pacemakers. One is fixed rate, another one is the standby mode. The next video we will discuss the remaining types of the pacemakers. Thank you.